I was going through the symptoms myself, and I found them quite worrying. The first thought I had in my head was, wow, this must be something really serious. And I thought, if that was me worried about this so much, and I kind of lost it a little bit, for a while. How do women who has no medical background feel about her first symptoms? And this must be really scary. We need to start this conversation a lot earlier. I think a woman who is in her early 40s should really know what to expect, but also what can be done to help to minimize those symptoms, because there's a lot that could be done. I would like my women to be empowered about their health.
For too long, talented experts with a service-based business like coaches, consultants, and freelancers have been losing out to the often inferior competition, and for just one reason: they struggle to communicate the true value of what they offer. When you start your business, it's likely that you started to help other people, but you know that staying invisible and offering discounts and being pushed into hard selling isn't the way. And you know in your heart there are people out there searching for your expertise and your learned wisdom. If only you could figure out how to connect with them. If you can relate, I'm excited you're here, as I believe that value whispering can help. It's the art of knowing your true value, then weaving this through every amazing thing that you do, so you naturally stand apart from your competition and have an impact that matters. Welcome to the Art of Value Whispering podcast. I'm Melitta Campbell, and I'm excited to be your guide. Now, the other thing that I also know about business is that it's not just about communicating your value. It's not just about showing up. What enables us to do this is our mindset, our confidence, our habits, our productivity, and our health overall. And on that topic of health, I know personally, as I'm moving into midlife, things have changed. Things that used to work don't work. Brain fog comes in. Suddenly, I can't remember people's names. There's all sorts of things that are changing. And I know for a lot of listeners, it's the same situation. As you move into midlife, things around your health and your mental health as well just aren't the same as what they used to be. So I'm excited to have invited Dr. Olga Morton onto the show. She is not just a medical doctor, she is also a lifestyle medicine practitioner with a lot of experience around menopause and guiding women to finding that right solution for them and understanding exactly how different elements of our lifestyle can help or hinder our journey through the menopause, and can help us to stay in control of that journey, to feel our best selves, to have enough energy and focus to achieve our goals. But how do we do that? We'll dive into that with Olga in just a moment. But before we do, I want to invite you to join the Dream Clients Club. It's my free membership for service-based business owners who are looking for additional support with their messaging, marketing, sales. They're looking for a community of like-minded business owners who will support them and share ideas, answer questions. And it's a wonderful community. It's what a lot of coaches charge quite a bit of money for to be part of every month. And for you, if you join the Dream Clients Club, it's completely free. And every Wednesday, I'm live there in the value sessions, helping guide you through the value whispering process, helping you understand how to build stronger connections through the way you choose to market your business. And it's also where you can discuss what we talk about here on the podcast as well further. So do come and join us. You'll find us at melittacampbell.com/club. Meantime, let's welcome Olga. Olga, welcome. It's great to have you with us on the show today.
Thank you so much for having me, Melitta. The pleasure.
And as always with my guests, there's always questions that my audience have, and that's why I invite a particular guest on. But usually it's also a big question that I have. So I'm like, oh, I'm coming up to menopausal age. I'll be turning 50 this year. And I have noticed that there are some changes, and sometimes those changes do show up through my performance. So I'm very curious for myself, and I'm sure for the rest of the audience as well. How do we manage those changes in our performance. Well, so many changes in the way that we are and show up in a kindful way when it comes to the menopause. And I know that you are not only a medical doctor specializing in menopause, but also a lifestyle medicine practitioner. So you have those two sides. So I couldn't think of anyone better to bring on the show. So thank you for being here with us today. Before we dive into a nice, juicy conversation about all things menopause, could you just share with the audience a little bit about your story? How did you go from becoming a doctor, or why did you even choose that profession to start with? And how did you choose now to start helping more people outside your practice with the lifestyle side of things?
Yes, so thank you, Melitta. I mean, I trained as a doctor, as a medical doctor, and after I finished my training, I was always curious and I wanted to do more research. And I completed a PhD, a doctorate program in autoimmunity and immunology after my medical degree, because I wanted to know how does autoimmune disease develop and what is that trigger? Because we have been told at medical school, well, the cause is unknown, and it's just most of the time it's just a bit of bad luck, maybe bad genes. And at the end of that doctorate program, I've learned that, yes, I was developing actually new drugs to treat those autoimmune diseases, and they were effective and they would help, but they also would have significant side effects. So that was my takeaway from that research experience. And I went back to clinical medicine. I missed patient contact. And I think I'm very much of a people's person and I like to be around people. And I trained as a general practitioner, which is a family doctor in Britain. And again, just a few years into my practice, I realized that in conventional medicine, we are so good at treating acute illnesses. If somebody has broken a leg, we know how to fix it. If somebody has an emergency, a heart attack, we know how to fix it. But we are not very good at treating chronic illnesses. And quite often, what I found was we had almost like a Band-Aid plaster on the symptoms. We would help the symptoms, but very rarely would either have the time or the skills to get to the bottom of the problem. And that's what led me on the path of lifestyle medicine, which is a fairly new specialty, I would say. And some might argue there's nothing new to that. And yes, to some extent, I agree, because lifestyle medicine looks at 6 pillars of well-being, and those are nutrition, movement and exercise, sleep management, reducing toxic substances, creating social connections, and stress management. And so when you're looking at the person through that lens, using that holistic approach, you are more likely to help that person to maintain their health and help them with their chronic illnesses, not only to prevent them, but sometimes even to reverse them. And then from there, naturally, I progressed into helping women. And the reason I was so keen on that, because I started seeing women coming to me with menopausal symptoms, and they would be very confused, very often frustrated. I think also with the current approach to menopause, which again sees it as what kind of prescription can I give you? And I think that's where I felt like these women really need more help, deeper conversations, and more holistic approach to their symptoms. And then I was going through the symptoms myself, and I don't know how about you, but I found them quite worrying, because just a couple of years ago, I noticed my first symptoms, and they were night sweats. And when I first noticed them, the first thought I had in my head was, wow, this must be something really serious. Like I probably have a rare form of cancer or something. And it lasted maybe for a few days. And I thought, wait a minute, you are that age, you're probably starting to develop, because, I had no other symptom at all. And I thought, wow, if that was me worried about this so much, and I kind of lost it a little bit, for a while. How do women who has no medical experience, medical background, feel about her first symptoms? And this must be really scary. And again, and I think, we need to start this conversation a lot earlier. I think a woman who is in her early 40s should really know about, what to expect, but also what can be done to help to minimize those symptoms, because there's a lot that could be done.
Yeah, I love the whole journey and that realization that you've had, and wanting to help women that don't necessarily understand what's happening. And I know Davina McCall, for example, is doing a lot about this, and I was reading her book, and it's the same for a lot of these women. They think they're dying or
Yeah.
going completely insane, but it's just the menopause. But I think the challenging thing is that it is so different for everybody. And I remember hearing a doctor a few years ago. I was at a women's conference, and she was talking about the importance of hormones for women, because our hormones are what cause heart attacks and strokes and various different things to happen. Whereas for men, it's the cause is different. So we need to understand our hormones. Like, okay, well, where do we even begin with that? So I think having these conversations, so we could recognize the symptoms and then start to understand how we can control that. So we had a conversation a couple of years ago about breast cancer on the show. It was a panel discussion, and we were looking at how helpless so many women feel when they get that diagnosis, but actually how much control we have, that there is actually a lot we can do to look after ourselves and minimize those symptoms, and understand, tune in with ourselves and start to feel more balanced. Is that where the lifestyle thing comes in, or is there medication that can help with that, or is it kind of depend for each person differently?
Well, yes, I think it's really both. And I think we need to respect and recognize the fact that we are all different, because I see women who start on medication, which is, probably, it's the hormone replacement therapy, or HRT, and they do really well on that. And there are women who have tried HRT and various types of HRT, the tablets, the patches, the gel, and the combination of different forms, and they still had their symptoms and they still struggled. And then there are women who cannot have HRT because it is not safe for them. So they, for example, went through breast cancer, and they feel really excluded from this conversation because there isn't really much out there offered to those women. And some of them go through menopause very quickly. Not only they would have the breast cancer diagnosis to deal with and the treatment, some of them would have undergone the surgery and chemotherapy, and then they are on hormone blocking therapy, which means they are sent into that menopause really early, the chemical menopause. And that is a lot to deal with.
Mm-hmm.
And and then there are women who choose not to have HRT. They would like to do it naturally, and they would like to know more, to know what are their risks. Is it okay not to do it? Because there's a lot of that as well now, because in the media, I think HRT has been given a lot of importance, and I understand it makes logical sense. We're trying to replace the hormones, but I also see this, what I see in my clinic is that it doesn't help to solve every single problem. So we really need to be mindful of that. And that's why I think it really depends on a woman. And that's why we need to have this conversation with a woman. What would she like to do, and how does she like to approach this? And we also need to teach these women the tools that they can use going through menopause, so then she can go back and use those tools when it's needed. So for somebody, it might be being started on treatment. For somebody, it might be looking at their lifestyle maybe a little bit more. For somebody, it might be learning how to give yourself a permission to look after yourself, and to prioritize self-care, because let's face it, it is hard for women. So I think when women reaches menopausal age, usually she would have children to look after, and they would be teenagers by that point. Quite often she would have elderly parents who also need caring. And then they have a career and that she's really passionate about and she would like to keep going. And I'm one of those women myself. I have a family, I've got kids who are teens and preteens, and I know how hard it is to make sure that you do find time to look after yourself, because for a lot of women it feels selfish.
Yes.
We think it's a luxury that you shouldn't be doing. You shouldn't be going out for a walk or something with your friends. You should be doing something else. And I'm not talking about anything, extraordinary, like going to, a daily spa. It could be really little simple things, like even just meeting a friend up for a cup of coffee, or, to have that chat that sometimes maybe fills your cup, like your emotional cup. And so that whatever is on your chest, you've discussed it with your friend maybe. And so finding that time, and I almost feel like one of the tools that I talk about with my women is you really need to slot that in into your busy work schedule, because if you don't put it in your calendar, it's not going to happen. So it has to be as important as, you brush your teeth every morning and in the evening, and so it's not negotiable. So that thing needs to be non-negotiable, because I think we need to look after our mental well-being, our emotional well-being with the same importance as looking after our physical health. And these could be little tiny steps you could start with.
So if we were to go back, so there's, I want to come to what are the things to look for, because I think a lot of women don't realize they are going into the menopause. And so things start to change or not work the way they used to. And then they have this blame or guilt because they don't realize it's just the change that their body is going through. They think it's something wrong with them. And then I want to come back to as well, how can we give ourselves permission? Like just to ramp up just how important it is to fit that self-care in, and what happens if we don't. So I'll come back to that. But could you talk a little bit about what we should be looking out for, and what things may change for us that we might miss or put down to something else if we're not attuned to it?
Yes. So I think, well, I would probably like to mention the word, pre-menopause, perimenopause, those three terms, and menopause. So premenopause is that time before you're entering the perimenopause. Peri in Latin is around, it's that time around the menopausal age. And so in premenopause, you might not have any symptoms. But your hormones might start changing already. They slowly starting to decline. And that happens even in the early 40s for a lot of women. And so then in perimenopause, you might have symptoms that are, broadly speaking, divided into two groups. So the symptoms are directly linked to hormone deficiencies, and those are the hot flushes and night sweats and dryness down below. And those are directly linked to your lower levels of estrogen and progesterone. And then the non-specific, so to say, symptoms, they're not necessarily maybe linked to the hormones directly, but those could be so many. And women describe brain fog, they describe joint stiffness and pain, they describe mood swings and just being really tearful and being short-fused, and every little thing could be irritating. And then sleep problems. And the sleep problems, there's like a double-edged sword with that, because you're going to be having the hot flushes and night sweats, and that's going to be disrupting your sleep. And then if your sleep is already rubbish, that will just make all your other symptoms more pronounced as well. And that list of other types of symptoms, I mean, it's endless, because every single woman is different. And an interesting thing is, again, I think for a lot of women, we don't realize that you might still have your regular periods. And quite often we think, oh, well, it can be menopause, but it can be perimenopause. And that's when your hormones are gently declining. And maybe that's when you experience your first symptoms. And that word menopause that everybody talks about is that actually it's that one day in your life where, looking back, you can say, well, I have not had a period for 12 months straight. And that age is roughly, in the UK at least, on average, it's about 51. But that it doesn't mean that it stops there, you know. So, okay, you can say that, okay, I've reached my menopause, I haven't had my period for 12 months straight, but the symptoms can still carry on. And again, how long, and for every woman, it's very different.
So I guess finding that right balance, if everybody is so different and experiencing things differently, then what's going to work for them will be different. So as you're
Yes.
saying, in the press, we hear a lot about you have to have HRT, otherwise your bones will be like dust by the time you're 60 or whatever. But it's not always going to work that way. So is it going to your doctor and working with them to find the right balance, or is there anything else that we can do to understand what would work best for us?
Going to a doctor is always a good idea, because when I mentioned those other non-specific symptoms, they can have a crossover with so many other conditions. Like, for example, tiredness. You would like to make sure that your thyroid function is okay. You'd like to know that it's definitely not something to do with diabetes, for example, especially if you're overweight or if you've noticed that you've gained a lot of weight. What if your hair is falling out, and this might be linked to iron deficiency or low folic acid or low vitamins? So I would suggest getting even just a routine set of bloods done is always a good idea, to make sure that it's not just written off as, oh, well, it's just menopausal and other conditions are being missed. But then once that's ruled out, I think then that's when you can start making a plan. And I'm hoping that your clinician, your doctor, your GP, your family doctor will be open for that discussion. And most doctors are well trained now, because I mean, we have had so much conversation around this, which is great. And yes, and it's good to have this conversation. And I'm so glad that social media is also very obviously playing a huge important role in that. But then with that, I think that conversation went from hush hush maybe a couple of decades ago to now being of a little bit of a chaos, especially in the social media field. So really need to be careful where you're getting that advice from, and what are the qualifications of that person that you might have heard the advice from. And so I think speaking to your own doctor is always a good idea. But then the reason I'm so passionate about introducing lifestyle medicine into this conversation is because I would like my women to be empowered about their health, so that that power doesn't stay with me, where I prescribe something and then you go away and then you just come back for more of the same and nothing else will change. The purpose of doing lifestyle medicine consultations, for example, in menopause, is then to teach women about nutrition and the importance of what sort of foods are going to be supporting your hormones and what foods are going to be diminishing them, or not going to be very beneficial in menopause. How to exercise and what sort of exercise is important in menopause. How to reduce or minimize your toxic load, because again, we have been exposed to over 86,000 toxins in the last 30 years. And you might think, oh, well, there's nothing you can do because, it's all in the air and in the water. And yes, your liver is dealing with all these toxins on a daily basis. But if the liver it reaches that limit where there's nothing else the liver can do, because on top of that, you're also adding smoking to that, or regular alcohol consumption, or anything else that will help to reduce the job for that liver to detox your body constantly, would help again with your hormones and also metabolizing those hormones to make sure that you get the most of them, with or without HRT.
Yeah.
And so it goes about sleep, and then it goes about the importance of stress and why stress is important, because again, the hormone cortisol, which is a stress hormone, and it's released during when we're chronically stressed, especially. It's not that one-off stressful situation. It's like when we're exposed to stress day in, day out, and we're running constantly on high cortisol. And that cortisol uses the same chemical that is needed to synthesize or produce the cortisol. It's exactly the same what's needed for your estrogen and progesterone. So if your body is busy making cortisol all the time, there'll be less and less of that other chemical left for your sex hormones, your progesterone and estrogen. So that it's a complete seesaw phenomenon. And again, if we know that, that means that we can do something to alleviate those symptoms, to help your body to regulate itself better.
Yeah, I've been following your social media and your emails for a while now. And what I love about what you share is there's no guilt. So you talk about alcohol, and it's like, oh, here we go. You go,
Yes.
do not have that bottle of wine on a Monday evening. And I think we all know what's extreme. But what I loved about it was that you were looking at that balance, because as you said earlier, we have to have that self-care. We have to do what nourishes our soul. And sometimes a really good glass of wine just hits the spot perfectly. But then it's keeping that in balance. And what else could you change to make sure that you're not diminishing your liver's ability to process everything and therefore push you into having worse symptoms than you need or less sleep and so on. So I think it's finding that balance. And we say we're all different hormonally, but also in what we enjoy and what kind of lifestyle we want is different. So finding that balance is going to be key. But I recognize that we're all different, but are there some key changes? So we all know we need to eat better, move more, get more sleep, reduce our stress. We know this. But when it comes to moving into the perimenopause, menopause phase, are there things that we absolutely need to avoid or need to do? So one thing that I learned through a coach who was helping me with something else altogether, but we just had a conversation and she was like, just eat more leafy greens because I have these really bad hormonal headaches for 3 days a month. And I can't do very much because they're so bad. And I started eating consciously more leafy greens every day and they've gone. And I was like, wow, it was that
Yeah.
easy. But are there more things like that if we just incorporate a little bit more of certain things, it's going to have this really big impact for most of us?
Well, yes, I like to break it down. My program consists of 5 steps, yeah. And then the first step we talk about is if we talk about nutrition, I think even just a simple step like drinking more water it could be life-changing for a lot of people. And again, we don't realize it. Quite often when I ask my patients and my clients, like, well, what do you drink through the day? And I hear, well, I have a cup of coffee in the morning, then I have maybe Diet Coke later on in the day, and I have another maybe kind of Diet Coke or maybe juice. And very rarely they'll say, I drink water or I start my day with a glass of water. And that is just so basic, you think about it. But, we are 60% water. And in the afternoon, especially, I think we tend to, reach out for that cup of coffee because we have that energy slump about 2, 3 p.m. and we need to perform. And we think, I'm just going to, kick myself back into this energy state. And the opposite happens because you're then at that point feel dehydrated even more and your brain just wants to switch off and then you might develop that headache. Because any symptom we have in our body is actually your body trying to communicate it back to us. Hey, I'm not happy about this. Do something about it. And I think, yeah, and that's why we need to really listen to our body and think, what's going on here? So yeah, I think, hydration is super, super important. And I'm talking about 1.5 liters, 2 liters a day. I think that's what we probably need to keep ourselves well hydrated, maybe a bit more if you're going to the gym, you're sweating a lot, for example, on that day, so you need to replace that water. In terms of alcohol, that's the topic we really like prefer to avoid. But I think when we understand why it's important, it's always easier than to make that change, isn't it? Rather than if somebody tells you, well, just don't drink alcohol, and nobody likes that message. I mean, I enjoyed a glass of wine this last weekend because I was away with my friends, and it's always that balance. Am I going to get more out of it because I'm going to be emotionally more recharged? I'm having a good time with my friends. I want to share that moment with my friends rather than I'm having a glass of wine to make myself fall asleep at night because I'm so tired and I feel like I really deserve it. And that's not a good way really of dealing with that tiredness problem, isn't it? So then when alcohol becomes a crutch. And I think when you understand what alcohol does to your hormones is, well, alcohol is affecting your little internal thermostat. So we have a little, almost like a temperature control in our body, and that tells our body how hot or how cold it is. And with the decline or reduction of the estrogen level, that thermostat becomes a little bit wonky, it's not working properly. And so alcohol does exactly the same. So imagine if you're going through those estrogen changes already, and then you throw alcohol in on a regular basis, your hot flushes will get worse and your night sweats will get worse. And I have experienced this myself because when my first night sweat started, I thought, oh, what if it's alcohol linked? And sure enough, every time I would have even a tiny glass of alcohol, wine, I would have night sweats that same night, which was really spooky. And as soon as I stopped that, the night sweat disappeared. And so it's little simple things like that. And if you're going to go for alcohol, I would suggest again, with every glass of alcohol or wine you have 2 glasses of water after that. So it's flushed out of your system quicker and you're less likely to have the after effect. And then if you really don't want to drink alcohol, then there's so many non-alcoholic options, thankfully available these days, that you'll be included in your group of friends and you can share a fancy drink with them. So you can have that emotional positive effect from, getting together with your friends. So there's always different ways of doing things. And the other thing I just wanted to mention on the subject of alcohol is a lot of women don't realize, and we mentioned breast cancer there, that just having 3 glasses of wine per week increases your risk of having breast cancer by 15%.
Wow.
So as it's every 15 women per every 100 women will get extra 15 women will be at a high risk of breast cancer. I think, again, when we are given those statistics, that's quite eye-opening, isn't it?
Yeah, absolutely. And I heard Mel Robbins once talking about this idea of revenge procrastination, and it applies to different things as well. Like that idea that we get to the end of the day, we are tired, we know we should go to bed, but we feel like I deserve to switch off, have that glass of wine and watch something on Netflix. So we stay up and we push ourselves beyond what we know we shouldn't do. But I suspect this is going to feed into the self-care, bringing that consciously into earlier in the day so we don't get to the end of the day and feel I deserve something just for me because we've already had that moment. So we'll come back to that in a moment as well. But one thing I wanted to share, which was a brilliant reframe I heard a long time ago, and we think of, oh, I'm going to have a treat. And we brought up on this that, oh, treats means sweet things. It means having a ice cream or something like this. But we can switch that around to understanding, well, what's a real treat for our body is salad, water, healthy things, and to switch around what a treat means. So yes, we can have our glass of wine, but then really treat your body to some hydration afterwards. So I think we can reframe some of the things that have become ingrained in our beliefs that we deserve these things. This is what a treat means, and look at, well, what do I really need? How can I reframe that for myself so it feels like I'm living my best life and feeling better as a result, so that those habits then are easier to stick, I guess, as well.
Yes, absolutely. And then when it comes to food and diet, I don't advocate calorie counting, or I don't suggest cutting out certain foods. Yes, I do, but it's not to the point where you're restricting yourself to constantly obsessing about this, because once we are told that you can't have that, you start craving those things. But it's more about learning about different foods and learning how they're going to support your hormones. For example, you mentioned leafy greens, and we know that they support your liver, and we know how important your liver is. And especially those bitter greens, broccoli, cauliflower, those are fantastic for your liver. So if you're going to be thinking, is this going to nourish me, or is it going to deplete me of certain nutrients? And I think every simple food item you're going to be approaching with that question, I think it just changes your mentality, because then you think, actually, I'm nourishing my body right now with this green salad. And it's not because, oh, the doctor told me to have it. And so that just changes the whole perspective. And you're absolutely right. Reframing it makes a huge difference.
Yeah. So let's come to this self-care, because we know it's really important. And I've seen it in business that the more people have that self-love and self-respect, the better they're able to put boundaries in place that help them to perform at their highest levels, get more done, and really enjoy each aspect of their life the way they really want to. But if they don't have that in place to start with, then we end up with these kind of wobbly boundaries that break way too easily, and we go into over serving for everyone else and pouring from an empty cup, going in that direction. But we haven't necessarily been brought up to see self-care as so important. We've kind of been brought up as women, especially, that we need to give to everyone else first. We should be serving people, helping everyone else. But we need to turn that around, because I think this idea of self-love and self-respect, if we have the self-care in place, we're signaling to ourselves that we are worth it. We do deserve this. But how do we start to, or do you have any secret advice on how to start bringing that self-care into your days, bypassing that sense of guilt, or I don't deserve this, or I should help everyone else first, and then if I have time, I'll go for a walk or something like that?
I think you need to ask yourself, if I'm not well, am I going to be able to look after my children, my elderly parents, or whoever you are responsible for? And am I going to be able to be productive at my work? It's just as simple as that. And that suddenly that selfish thing becomes selfless. You're actually not doing it for, yourself even. You're doing it to make sure that others are taken care of. And so you have to see it from that perspective. And that's when self-care becomes a priority. And it could be different things for different women. For some people, just even finding that 2 minutes in the morning with a cup of tea and just sitting down in a quiet room with your own thoughts, that's already an act of self-care. For some women, going for a longer walk is something that is going to fill their emotional need. But again, it's different for every single one of us. And finding that moment, finding what's going to work for you is going to be important. And that's where you start. And you start small. We can't change things overnight. And again, when I work with women and we talk about all the different aspects of it, I always say to them, if you start stressing about and feeling overwhelmed, how much needs to be done, or how much you want to change in your life, it's going to be very stressful, and there's no need to do that. So start small. It's like in business, isn't it? If you want to try do everything at once, it's not going to work. So you have to have the foundation, but then you have to start slowly introducing small changes here and there so that you build up on that foundation. And that's how it works with women's health. And once you've then found those little things that work for you, you just make sure you maintain that, and then make sure that it is part of your, as I said, daily routine, weekly routine, so that it is not seen as a selfish act anymore, but it's a necessity.
Yeah, exactly. And I think everyone listening to this podcast has a business or is aspiring to start their own business. And so it's really important to make sure that you build in that time for self-care, so that, as you said, you can perform at your highest levels, you can deliver to your clients, you can deliver at the level you feel proud of, and still have energy left for your family, your other commitments, because few women I've met are just building a business. They're doing
Yeah.
a lot more around that. So we
Yeah.
really need that wellness, as you said, and that energy. So that can only come from doing the right things and taking that time for self-care. So it sounds like that's your prescription for everybody. Take time for self-care.
Yes, because I've got news for you. Nobody's going to come and tell you, oh, you're going to go have that rest now, because you almost have to become an advocate for yourself. And you have to also be able to recognize the symptoms when you're starting to burn out. And again, it's different for everybody else. For somebody, it could be the return of their back pain. For somebody, it could be the return of their sleepless nights. And for some women, it might be those annoying, persistent headaches that are suddenly there and you don't know what's causing them. And so even just having that ability to recognize the first signs of stress or overwork, or even the early burnout, that is already the first step forward, because then you can take action, then you can take a step back and start doing something about it.
Yeah. So we've talked a lot about nutrition there and taking time for yourself, lowering stress through the self-care. But what about movement? Does that need to change? I've heard that when you go into menopause, you mustn't put your body under stress, because then it produces more cortisol, which then counteracts everything else. But Is that true? Are there any do's and don'ts there?
Yes, again, there's no one prescription for all women. I would say any movement counts. And the more we move, the happier we are. The easier for us is to maintain, the normal healthy weight. Remember, the muscles actually produce certain chemicals that also affect our mood. So it's not just about weight loss and maintaining a healthy weight. It's also about the emotional well-being. And the only tip I would say is what we sometimes, I think, overlook in menopause. And I've seen lots of menopause yoga classes, for example, which are fantastic. There's, running groups, but I think for women, osteoporosis is something that we need to be aware of. And no matter, whether you're on HRT or not, yes, HRT, the hormones help us to absorb the calcium that the bones need, but the bones will still need the exercise, and that is that muscle resistance exercise. And it doesn't have to be a lifting heavy weights. And for a long time, I was shying away from weights because I unfortunately had a small accident where I hurt my back, and I thought, oh no, that's not for me. But it was simply I didn't do the exercises properly, as I've learned later in life. And when I returned back to even starting with small weights, I really enjoyed it because your bones need to be under slight pressure to be able to remodel and to become stronger. It could be just even your own body weight, even if you're doing squats or sit-ups. So that could be part of it. If you're doing your push-ups, even just that's again your upper body weight, that would be enough, but that needs to be part of your exercise routine. And then for the rest of it, again, it is what you like doing, because exercise also should be what we enjoy. And if we do enjoy doing something, we're more likely to keep up with it.
Yes. Same as with business, isn't it? If we don't enjoy doing it, we don't do it. So we have to kind of focus in on what do we enjoy. Yeah, brilliant advice. Olga, we've covered loads already, but I do want to come back to this toxic load because, as you said, that we are surrounded by toxins. So is it possible to reduce the number of toxins that we are exposed to? And are there any sort of simple ways of doing that or getting started with it?
Yes, it is possible. And as I said, when I talk about toxic load, it goes beyond alcohol, it goes beyond smoking. Because we have been exposed to the environmental toxins, and again, this is not something that I want you to feel stressed about, because you might, after listening to this, you might go outside thinking, oh, wow, what am I supposed to do? And, I've got no control over this. So I would say, 3 steps. So start thinking what's going inside your body, into your body. So yeah, detox your diet, detox your food. And by that, I mean, cut down the processed foods, the foods that will have E numbers and colorings and things that you can't pronounce. So if you can't pronounce the chemical, the ingredient that's in the food, it really shouldn't be going inside into your body because it's not really found in nature. The other common one is that refined oils. Those are usually inflammatory foods that can cause inflammation. And so even just by cutting down on those and going for healthier oils or healthier fats, olive oil or avocado, because we still need healthy fats, but the difference is, what sort of healthy fats you're choosing. Nuts, again, a great source of healthy fats, healthy omega-3. And once you've mastered that, again, bit by bit and slowly, then start thinking what's going onto your skin, onto your body. Because again, remember, the skin is your organ, and quite often we don't think about it. So whatever you put on your skin is going to end up inside your body. And that starts with, again, personal care products, your washing powder. Unfortunately, what I've learned through this process, I was on this journey, a lot of high street perfumes are hormone disruptors. So they disrupt our hormones. And even just switching over to natural oils, essential oils, can make a difference. And I recently had a discussion with a fertility expert on that. And it was very reassuring to hear that she agrees with that as well. And this is what she advises her women in her infertility clinic about, again, how to reduce the toxic load. And we both were surprised that, that came up again in our discussion. And then once you've done that, then think about your environment. Okay, what's your air quality like? And I'm talking about, again, plugins, air fresheners that are sometimes used to, make the air smell lovely, but then again, can the air just simply be clean? And we don't really need to mask whatever the smells are there with extra chemicals that we might be not even aware that we're breathing in every day. Candles, in most of the high street brands, if you're not looking at the quality of the candles, those are byproducts of petroleum, and you wouldn't imagine really burning something like that next to you if you knew what it was. And again, you're breathing in these chemicals. And again, you might think, oh, well, where's the fun in any of that? But it's about that little spillover, that your liver is doing that already. And most of the time, we don't even have to worry about any of that. But when menopause, when the hormones are already playing havoc, that becomes more important. And so every single thing will count. And so if you're going to help that liver, even the tiny, tiny bit, it will have more capacity to deal with everything else that you can't control.
Yeah. And as you said, it's not about changing everything. It's about finding those small little tweaks you can make bit by bit, as you say. So instead of going from that mass produced cheap candle that costs like a couple of pounds, it's probably a key indication that's not much good in it. And instead, I really started asking all the time, is it worth the calories, and spending a lot more on good quality things that I perhaps enjoy slightly less often,
Yes.
but I enjoy much more as a result. And
Yes.
it's made a big impact. And now when I have this, like a really nice candle or a really nice glass of wine, or, I really, really enjoy it because I don't have it so much, and it is really much better quality. And I have felt the difference in my lifestyle as a result. And I know there's so much more I can be doing, but it's always just those little permissions to do one small thing, I think, is
Yes.
probably, as you said earlier, the key. Otherwise, we'll just drive ourselves crazy, and then that's going to increase the stress, which isn't going to help.
Yes. And then it becomes your treat because you will cherish it more.
Yes,
Yeah.
yes, exactly. You can incorporate these into your self-care. And I guess it's a slight shift in just the way you think about holistically your whole day, and how that environment, the patterns in your day, the way you structure your work and what you give to other people, all of these things, just thinking about it a little bit differently as to how is it working for me these days, and look for those small changes that you can be making. Olga, thank you. You've shared so much, and I love that you've given everyone permission just to look at what works for them. And HRT, as you say, can be amazing, but there is a lot of people it doesn't work for, or you choose not to use that. And there are other ways that you can manage the symptoms as well. And I guess if you choose to go more down the lifestyle route and have HRT, that's only going to help you anyway.
Yes. And then remember, every woman is different, and we can't expect one treatment work the same for all the different women because we're all unique. And so you have to respect that. And once you recognize that, you will be able to work out what works for you because it has to also sit well with you. And this is why I work in partnership with women, listening to their needs, listening to what they would like to get out of it, rather than saying, well, here's a prescription and I'll see you in how many weeks, because I know it doesn't always work.
Yeah. So we have, as I said, touched on so much, but is there anything you feel that we haven't covered that's really important for women going into this phase, or right in the thick of it at the minute, that they should know about how to manage their health, feel great, manage their performance levels, anything like that?
I think I would probably add on sleep to that and just, how important it is. And again, we are so hardwired at the moment, just, the society expecting so much from us. And we're supposed to be wonderful mothers and wonderful wives and good performing, successful women at work. And it's just so difficult. And I think what I found as well as going through motherhood and having had children, how important sleep is. And to me, again, it's one of those non-negotiable things. And some of us are luckier than others, where we might not need so much sleep to feel and function well. But if you are one of those women who is sensitive, and you know that it's going to make you a huge, difference, then go for it and prioritize it. Have an earlier night and make sure that again, it's part of one of those tools in your toolbox. And then don't feel guilty about it, because this might be that one thing that will help you to get you through it.
Yeah. And I know for me, sleep is really important. All throughout my life, people have teased me that I must have been a cat in a previous life. But one thing that I've done, and people often comment on how much I manage to get done and how productive I am, and I'm perhaps not as productive as people might think. But one thing that really helps me, and it does feed into the self-care, is very regularly I have a nana nap. So I have my lunch,
Yeah.
I take a bit of time, and then I have a nap for an hour. I mean, working from home, you've got that big advantage. So at first I felt really guilty. It was hard to fall asleep because I was thinking, oh, I should be taking the dog for a walk. I should be doing this. I should be working on my LinkedIn or whatever it was. But now I realize that actually taking that time does make me feel so much more productive, so much more focused, so much more clear and happier
Yeah.
than, I've realized retrospectively it's so important. And that's what enables me to do everything else, is taking that time. So yeah, brilliant. Great advice.
Exactly. And there's a lot of evidence for that as well, that those power naps work for a lot of people. And if this is something that works for you, go for it and don't feel guilty about it.
Yeah. Fantastic. Olga, thank you so much. If people have really connected with this and love to know more about how they can manage their lifestyle during the menopause or connect with you, where's the best place for them to go?
I am on Instagram and I'm on LinkedIn, and you can find me on my website, drolgamorton.com. And if you would like to get weekly nuggets of tips on healthy lifestyle, you can sign up to my newsletter, and I try to keep it nice and brief and give you really practical advice that you could start implementing and using literally today, without any long emails that I know we're all very busy and I don't always have time to read very long emails, and that's why I keep them really brief on purpose.
Yeah. Well, I can really recommend joining your newsletter. It's one of those newsletters that I actually look forward to because
Oh.
I don't just learn something, I understand things in a very different way. Like the way you talked about alcohol at the beginning, I was like, uh-oh, here we go. But actually, you explained it so I understood and could make a better choice at the end. And I think that's a great thing about your emails, is that you're giving really advice that helps empower our decisions and our ability to create that perfect lifestyle for us. So thank you for those.
Oh, you're welcome. Thank you. And I am so glad that it's making a difference. Yes, because
Great.
that's the purpose, to again to empower women, to educate women, but also give them tips and give them the power and the agency over their health, so that they can feel in charge and they can feel in the driving seat, and not their doctor or somebody else who is telling them what to do.
Yeah, brilliant. I love it. Thank you so much, Olga.
You're welcome. Thank you. It was a pleasure.
Thank you for joining us today. I hope you have found this episode valuable and you now have a different perspective of what branding is, why you need it, and how to get started with your business and personal brand and use those to have more powerful connections, create more meaning, have that impact, and really enjoy your business going forward. If you have enjoyed the episode, then please do take a minute to help another business owner and share this episode with them. And I'd love it if you could leave a review on Apple Podcasts. That really does help more people to find the show. And again, I would love to have you come and join us at the Dream Clients Club and to welcome you to our next value session that take place every Wednesday afternoon European time. These are weekly live marketing masterclasses with me. And in the next one, we'll be talking about exactly how can you get stuff done without going completely insane. It's completely free to join. You just need to register at melittacampbell.com/club. There are a lot more tools, tips, and insights coming up for you in the next episode. So don't miss next week's show, or better still, subscribe now so you never miss your weekly dose of inspiration. I'm Melitta Campbell, your business coach and value whisperer, and I look forward to seeing you in the next episode. Bye.